the ceiling in a way that would have made it difficult for us to wait for the beds in the city ICC. And therefore, we procured beds from the private sector to accommodate those. But fortunately, in the process, we ended up with a situation where we didn't have the numbers rising in the same way as was expected. As a result, therefore, we have not seen the numbers rising to that extent. But we have said they must increase the beds because we need about 4 to 6 weeks to be able to create additional capacity beds. At the moment, for the next month, we should be able to cope. And then, of course, we are saying on a day-to-day basis, we assess where the needs are going to be so that we can put additional beds. So we have seen us opening up beds in KwaZulu-Natal, in the field hospital beds. We've seen us doing beds in Cape Town, in City ICC, in Khayelitsha, in a number of other places. We've seen that us doing some of those in Gauteng, in Nasrec, and last week in Port Elizabeth, we've done that in a number of other hospitals in East London. Those are beds to prepare for people to come in when the numbers start increase. We have not occupied those beds, we have not filled those beds, but we are then saying as the days go, we actually keep assessing how many more beds will we be needing in another month or so. The estimation that we're working on are very varied because the modelers give numbers, but they have to keep changing to try and adjust these numbers. But we must say that at this point, at 138,000 positive cases, we should expect more people getting admitted. And of course, some may succumb, as we have seen. I'll give you a few figures just now as what has happened as of today. But we are doing our best. But the key is not so much how many beds we have. You can have any number of beds. If we don't control the rate at which the infection spreads, you may ultimately get your health services overrun by the numbers. So as much as we are getting to answer the question whether we've got enough beds, it also depends whether our people are distancing enough and are putting masks enough so that the total number of people who are infected does not increase so rapidly as to overwhelm our hospitals. Yeah. At the moment, we can cope.
And let's talk about ventilators in a minute, but it was interesting. Minister, at one stage you were saying that maybe 20% of those infected would need hospitalization. Is the picture actually looking a little better than that grim prediction? Even the death rate, it's no consolation for people who have lost loved ones, but seemingly quite low compared to some parts of the world.
Yes, indeed. We must say that for the original estimation of what we could have been facing, we have not reached that point. And we have expected that about 20% of those who are who are positive will actually be in hospital and maybe in intensive care. Our numbers are showing less admissions than what was originally thought. For example, as I was giving the example of the Western Cape, we ended up with fewer admissions than what we thought. And even in most of the cases, even the numbers of deaths, although certainly they are increasing, but we must also say that those numbers are a bit less than what was initially thought would be the case. However, that can't necessarily last forever. We may still see those changes, the numbers increasing, depending on how many people end up getting infected. So we have the numbers who are in admission right now. There are just over 3,800 people who are in, which is not as high a number if you compare to the numbers of positive that we've got, but also the numbers who are in the ICUs are also lower. They are probably in the region of about 600 or so, about 1,000, over 1,000 at this point. Then in that context was then seeing that there's quite a lot of proactive management by our clinicians for putting people early on oxygen, even in general wards, and therefore we are seeing at the moment the numbers of fatalities, although it is sad, but we're still seeing that those numbers remain at a lower percentage at about 1.8 to 2%, which is lower than what we are seeing. India would have been seeing about 3.18%, and Brazil at about 4.5%, and some of the parts in Eurozone are over 5%, as it were. So that might be early days for us, but nevertheless, I think we need to commend our health workers, particularly those who are managing cases in the hospitals.
Yeah. One of the concerns, well, it always has been, is ventilators. So you've looked at projections. You say the next 3 weeks will be very difficult. How many ventilators do we have compared to what will be expected in coming weeks?
Well, we have actually tried to match the numbers of ventilators to the over 5,000 ICU beds that we've got, but we have actually ordered now about 20,000 ventilators that are in the process of procurement, and we want to be able to get them. Some of the ventilators are at a level where we can actually utilize them in smaller hospitals, which means it will help us to get some of the smaller district hospitals to manage earlier to support the patients. And in so saying, our intensive care specialists are actually saying that we need to have what we call positive pressure, which is what you use before you get full intubation intrusive ventilators. So we believe, therefore, that we must increase those ventilators to the extent that we will need, early interventions at a lighter level, where all you do is provide positive pressure with oxygen. And as you would have heard, that with the use of dexamethasone early, which is now our protocol, all of that together is going to make it much more easier for us to achieve better survival rates. Already, I must say that our teams have already been using dexamethasone, but as you move into the various provinces, I think all of us are getting ready to, if we get some of those ventilators, they should be available at lower district level. So we're looking for the kind that must be easier to use, so that once you've taught someone, they should be able to support people in the peripheral hospitals without having to go to the central hospitals. Yes. So all of that is part of what we have to do. If I may just indicate, certainly we have indicated that we have lost at this point an additional 43 people who we really wish to convey our condolences to their families and relatives on the loss. And that gives us a total now of 2,456 lives lost. And we do want to also convey our gratitude to our health professionals who are looking after these patients, where a lot of them have also got infection and a few have succumbed themselves. And we do want to say that they are our heroes in the front line, who really have done everything and given their all to make sure that we can save our people.
I'm sure they'd appreciate that, Minister. Thank you. Can we look at the various provinces now, zooming in to the Western Cape, which of course still has the highest infection rate. You've got the updated stats, but for the 24 hours until yesterday, 41 more people died there. The death toll over 1,700. Are the figures reflecting in the Western Cape right now? Are these peak figures?
No, they are not peak figures, but they are showing an increase in the numbers. 1,700 deaths is a lot of people. And indeed, as we say, we really do regret that we are losing some of the people already. We've indicated that a large number of them have got what we call comorbidities, largely cardiovascular diseases, hypertension, diabetes are the key issues that are associated. And of course, others such as cancers, pulmonary diseases, chronic chest diseases, and those kinds of challenges are associated with this. But the numbers are not showing the highest we're going to get. The numbers, we expect that the numbers will go much higher. One of the models has given us a figure of about 7,000 people that might have been lost by the middle of July. It is possible that we will get to that number. It is also possible that this is for the whole country, that is. It is also possible that with those numbers might be a bit higher than that. It depends how we manage the numbers of people who get infected. That's why the issue of containment, masks and washing hands and all of that becomes very, very urgent.
Well, one of the major issues in the Western Cape was simply resources, a plea from that province for volunteers and for national assistance. How are the provincial and national governments working together right now, looking at the hotspots in the Western Cape?
Well, I'm very glad you raised that question, because sometimes we get to think that the Western Cape is a different part of the country. Actually, we're working very closely with the Western Cape government. Where there are weaknesses, we come in, we bring in the issues, and we discuss with them where there's shortages. Now, let me just say what we agreed with them earlier. They were raising concerns about the staffing numbers. And we sat down and looked at, and we actually agreed that need to open up and invite more people to be employed. At that point, they recruited close to just under 1,000, I think 800 and something nurses. And then we sent a call to the different provinces to say where there are additional professionals, they should make themselves available in the Western Cape. And in this case, that is happening. So what is then, at that point, Western Cape was obviously our epicenter, and so we gave them the support. And in addition, we actually reinforced with the Cuban doctors. We've even brought in additional senior managers to go in and give them the additional support into ensuring that all our programs are aligned, and we're happy to say that the programs are aligned. Of course, there have been some weaknesses that we've had to try and correct together, and so the rest of the country is not moving at the same pace in terms of the weight of the burden. So we do expect that the numbers that we have seen in the Western Cape, very soon we're going to be making a call for more people to come over towards Gauteng, as it were. So these numbers are going to keep shifting, and the call for the Western Cape was they opened the beds, they need to get us more, they need to get more staff. Then we also went out to say they must recruit, cooperation of private general practitioners, something that we are working very hard on, and at the same time, they've also feel that the additional resources that we've made available to them.
And we'll get to Gauteng, another worrisome province, but firstly, let's look at the Eastern Cape, Minister, because we heard to the alarm of many South Africans recently from the Eastern Cape MEC that the provincial health department is bankrupt. What additional assistance has been put in place there?
Let me put the issue into context. For COVID-19, there was never a budget. So every province is going to run out of funds to manage COVID-19. That's why the Minister of Finance last week tabled a budget where he called for reprioritization and also additional resources that our President Ramaphosa has said we must add onto the health budget across the different provinces. So it is not just Eastern Cape that's got a challenge. We've spent a lot of time discussing that with other provinces such as Western Cape, where they've said, look, we have a plan, but we need to know how to implement it, who's going to pay. And we've had to sit down and say, let's wait for the budget to come through. So part of resolving that problem is the budget that Minister Tito Mboweni has tabled. And so we hope that also with reprioritization in every province, we should be able to move resources to the area of need, and that is the control of the pandemic.
And I'd love to talk about some of the specific hospitals in the Eastern Cape. But Minister, you mentioned Gauteng, that is becoming more and more of a concern. An academic there saying that Gauteng could reach the Western Cape's 24-hour death figure pretty soon, maybe in coming weeks. That's about 50 a day. I mean, it's not a good competition to be in, but we're on the coattails of the Western Cape.
Well, look, I think we must make a comparison in context. And I don't think we must always put the provinces as though they are competing. And we must also not put the provinces as though everyone out there, this one is right, this one is wrong, because that will be an unfair way of managing this pandemic. The fact of the matter is that the pandemic is new. Now, what happened in the Eastern Cape, in the Western Cape, was that the original pattern we expected was that Gauteng should have had the highest numbers in the first instance because of the large size of population, because of the migration that's happening in that area, because of the large number of poor communities, which are more than what you have in the Western Cape, which is numbers of informal settlements, and the numbers of economic activities that are going on there. So that gives you a huge amount of mixing. So anyway, Gauteng was going to give us the highest numbers. However, they were able to manage the issue of contact tracing and isolation and quarantine early, so they benefited from the lockdown in a way that Cape Town or Western Cape was not able to. So the numbers in the Western Cape moved uncharacteristically and in an unexpected way higher because of the cluster outbreaks that happened there. So this is going to change with time, where in numbers in the Gauteng area, because now we've all opened up the activities and people are mixing and people are traveling, the numbers are going to be much higher in Gauteng. So we shouldn't be surprised. We do expect that the numbers will be highest in Gauteng ultimately, and that in fact the original predictions was putting Gauteng first and KwaZulu-Natal next. It just so happened that it didn't follow the pattern as we're seeing now. So there's nothing that would surprise us with the numbers in Gauteng going much higher than what we're seeing in the Western Cape. And I think that we need to be aware that the situation in Gauteng was contained for a short while, but once we've got mining companies opening, we started seeing the numbers shooting up because of the clusters that arose in the mining areas. So these are not unexpected, but we don't really want to see numbers going as fast as they are doing. And that's why we've been saying to our, to the public, please let's work together to delay the spread of the infection, to delay the surge as far as possible. But our predictions, our models have said, whatever we could do, we would not be able to delay the surge much later than July, August. As that's why we've then felt it is not going to help us to continue with the lockdown for more than the time that we did.
Yeah. Well, Minister, the preparations, things that have been done and now being tested in all of the provinces. I mean, looking at Gauteng, if we stay there, Nasrec, very high profile. We understand more than 90 patients there. Are those things working? Is Nasrec working? And the field hospitals and the quarantine sites that have been established?
Yes, the numbers of patients in Gauteng are increasing. At this point, those numbers are approaching about just over 1,000. And in that context, what we are then seeing is that the numbers are beginning to increase in a way that we need to be forward-looking. So in our discussion now with the MEC and the provincial department, our approach has been that we need to start investing in additional field beds that must be able to take over once the current ones are filled. But we're still very far from filling the current beds. It's just that obviously, because we can see the numbers are increasing, we need to be aware that the surge is nearing. And that is important for all of us to not be in denial that the numbers are going to be increasing, and that even if we are not yet feeling the pressure today in terms of the numbers, we must prepare for an eventuality where those numbers ultimately, become a reality. So we are still hoping, but nevertheless, we need to increase the beds so that when in the next few weeks, when those numbers reach capacity, we've got additional beds to be able to take over and manage the additional load that will be coming in. So Gauteng is looking at that, and we're discussing more additional possibilities of where the beds must be located. But right now, there are beds to be able to absorb, but the numbers are going to increase.
Minister, in finality, is it fair enough to say that there's pressure across healthcare facilities, and it's not about the doctors and nurses only treating COVID-19 patients? I mean, we heard this report about the Dora Mkhize Hospital in the Nelson Mandela Bay, where caesarean emergency Caesars couldn't be performed at the maternity ward. Nurses had tested positive, and there was simply no staff. Reports of Ritflay in KwaZulu-Natal. Is that pressure spreading and affecting many South Africans with other illnesses, with other health requirements right now?
Indeed, indeed. You see, the problem that we have been now working on is how to encourage people not to miss their treatment. If they've got TB, they've got HIV, they've got diabetes, they've got blood pressures, they need to continue to take their medication. We've even said where people are not under serious, ill health, they should actually extend their script so that it lasts for longer. So they must keep their medication as far as possible. So that is something that we must work on. Immunization needs to continue. Ordinary ailments still will cause more death than COVID-19. So it will not help us to ignore or neglect the rest of the other ailments just because there's COVID-19. So we have to try and keep a balance. So what you're talking about, Dora Mkhize and others, I think there you are dealing with a labor issue, a labor dispute, which is not a standard problem right across, but it's something that needs to be given attention to. I've already been in discussion with the MEC and the head of department in Eastern Cape. I've actually dispatched a very senior official to go and help them to ensure that on the ground in the Eastern Cape, there's a much more tighter coordination of their activities so that we don't get derailed by simple things such as some cesarean section not being done, or people who are turned away, or the complaints about people not being able to have access to oxygen. All those issues we're giving attention to, and we need to make sure that those are solved. But we're sending a very senior health administrator to go and reinforce the Eastern Cape on top of the ones that were sent already before, so that the province must never feel that they are alone as they deal with this issue. But the pressure is going to be experienced right across the country, and when we do so, we need to keep a strong balance. A few weeks back, I did get a communication from some of the professionals, the doctors, the clinicians, and the nurses who were saying they just wanted us to make sure that there is a balance in the way we attend to COVID-19, because even if it's causing a lot of anxiety and is spreading fast, it's still a far lower cause of mortality compared to the rest of the conditions that we've been treating in all our hospitals all this time. So the balance will remain very, very, very important. But the pressure, yes, is mounting now.
All right, thank you very much, Health Minister Dr Zweli Mkhize, for that very comprehensive view of the readiness of hospitals. July, August coming, the Minister saying that the surge cannot be pushed out further than that. In other news, the Department of Public Enterprises says the forum formed to help develop a restructured South African Airways is not serving its purpose. It's one of the reasons the department gave when announcing its withdrawal from leadership consultative forum that was set up. This may impact the